Recently, I was at the Oracle Health Collaboration Forum in 2024, where I got to speak to some of the Oracle Health customers and partners about the intricacies of rolling out an EMR across diverse health services and the importance of digital solutions in improving patient care. In this feature episode of the Talking HealthTech podcast, you'll hear a number of those conversations as we dive deep into the practicalities of implementing technology in complex health systems and the future priorities and technological aspirations for their regions. To hear more of these conversations that I had at the Collaboration Forum with Oracle Health, jump back into a previous episode in this feed where I spoke with some of their executives and leaders around the world about eliminating health barriers, the importance of data integration, and how Oracle Health is localising their capabilities to meet the needs of the Australian healthcare system. But right now, here are some of the conversations that I had with healthcare changemakers and leaders from around Australia at the Oracle Health Collaboration Forum. And collaboration starts with a conversation, Team HealthTech. Let's make it happen.
My name's Raelene Donovan. I'm actually the Acting Chief Clinical Information Officer for eHealth Queensland.
Excellent. And so, eHealth Queensland, so for those that don't know, we've got the different HHSs across the state.
Yep. So eHealth basically is the central agency, basically. So from a Queensland government point of view, we've obviously got different agencies, Queensland Health, there's a number of different corporate or sort of central divisions, and then obviously we've got the health services that sit underneath it. So eHealth sort of oversees all the major enterprise ICT applications, basically keeps the lights on.
And tell me a bit more about some of those initiatives that I guess are driven from the eHealth side, and then how that plays into how people might see it within the defence.
So one of the big things with Queensland, which is probably a little bit different to our other jurisdictions, is we have an enterprise EMR. So the IMR, so it's actually one instance of Oracle across Queensland that we, as I said, we've rolled out over several years and we're continuing to roll out. So we're doing another big push at the moment. So our rural facilities are coming on board. A couple of our big metropolitan sites are coming on board. So the whole aim is to have one unified medical record, basically, for the majority of Queenslanders.
Yeah, interesting. And so the benefit of having, Queensland's a pretty big state.
Yeah.
So then in terms of
no mean feat.
Yes.
How do you get 16 HHSs to actually agree on something?
Well, let's start with that one then. I mean, you understood that because that's a tricky one.
Yeah.
So tell me about how that's coming together.
I think, as I said, we've got a federated system. So as I said, we all have independent health services, but at the same time, there's a lot of benefit from actually working together. So that's where we have some enterprise applications. So the common big things, you get more value when you actually have a single instance. So many years ago, we've got one pathology system, and so everybody is actually able to access and see all those pathology results from across Queensland, no matter where in the state someone actually has it, as long as they've had it with Pathology Queensland. And that's the same methodology. Like, we've seen the benefit for years in terms of actually having that sort of unified access. And so when we do the EMR, that's what we've done. So we've got one single instance. And so, as I said, once you've got started and then actually doing the rollout, and we've actually created a network, which is actually really quite a positive thing. So we've got all our digital sites actually work together. So we know that we've actually got to get agreement when we actually put something into the system, and like, how do we actually make it work for everybody? So it does actually open up the ability to actually have a lot more standardised workflows. What's best practice? How do you actually create that? How do you give equity across all the health services? Because there are some nuances. So there's a little bit of negotiation, a little bit of sort of working together. But as I said, I love it. Like, we've actually got phone a friend anywhere in the state, basically, and say, hey, we've got this problem. Like, how have you solved it? Oh, we've done X, Y, and Z. And then start working together and leverage each other.
Interesting. I definitely see the benefits from an operational side, or from understand, like, learning the best practices from each particular HHS. I'm thinking in terms of, we're talking about it's beneficial that, there's consistency across the state. Is the benefit more so from a visibility of from a public health point of view, or is it more from a patient side?
There's probably two things, or probably three. There's several things. Let's just say that. There's many things. So from a consumer point of view, it's great. Like, I can turn up to my hospital, for example, because I still work clinically, and I can see Mrs. Jones's what's happened today in outpatients, for example, at my facility. Or actually, I realised that last week she happened to be up in North Queensland, and so she had to pop into the hospital. I can actually access that. So she can tell me what's going on, but I can actually see the more granular detail under it, and I don't so you actually have a much more rapid decision making. I don't have to pick up the phone and ask Cairns, for example, to fax me information or email me information. I can actually see it in real time. So that's that benefit from the consumer as well as clinician. In terms of probably the other bit is historically, like we've got a very Clinical Excellence Queensland Health Improvement Unit where we actually look at how do we continue to improve what we do. So what's best practice? How do we develop pathways? So we've got a lot of paper-based systems historically that have actually been best practice pushed out in terms of and adopted from the health services. And so what we've done is, by doing that across with an electronic system, it's something that we're actually quite used to. And then again, you just have to adapt. So paper into a digital world can sometimes have its challenges, but I think we're even like listening at the conference this week, you can see how we've actually all started to mature. Going from paper to a digital system isn't just picking up paper and making it electronic.
Yes.
There's a number of things that we should actually be doing to make it better and easier for clinicians. Probably the other big thing that's the big benefit of the enterprise system is the fact that all that data, so how blood pressure is recorded in, one facility is pretty similar and it's actually documented in the same bit, and we've got all those access to all those data points, so all our consumers. So from that, we can actually obviously do a lot of analytics over the top of it, both from an operational as well as a clinical thing. So the whole concept that we try and tell clinicians, which is the big value around it, one is on the ground, I get access to information. But then if you're actually wanting to look at how to continually improve things, you can actually use that data to actually feedback. So is it a workflow? Is it a model of care? Is it research or that? So that's how the data goes back into it.
Yeah, amazing. And so, as you suggested, there's some exciting innovations that are ahead, particularly from the Oracle Health point of view, and just generally within the healthcare ecosystem. That's where a lot of the attention is in terms of the role that technology is going to play with all these emerging technologies. There's still healthcare to do on a day-to-day now. Where are they in terms of eHealth, Queensland and the state and the role of technology? What are you excited about seeing over the next 6, 12, 24 that people might see?
I think what everybody's wanting, it's tech to solve all its problems.
Yeah.
I think for me, what you see now is there's a lot greater awareness from both clinicians and consumers around technology, what it can do. So there's now that expectation from both part, like whether you're a part of the workforce or whether you're actually receiving care in the hospital. I know how technology changes my life when I'm just out doing my shopping or trying to book an appointment, to a dinner or getting my hair or whatever it is. I know how to navigate that, and I want my health to be the same. And so there's an expectation that why can't we do that? How do we actually make it easier? The other big one is we know that we've got more demand for our clinical care. We've got more patients, more bigger disease profiles. Everyone's sort of trying to access the system, and we've got a limited number of clinicians, a limited number of bed spaces. So everyone's looking at technology to say, how can we actually reduce the burden? How can we actually improve the workforce capability? How do we actually improve access to care? So there's a lot of enthusiasm and a lot of interest, and we've just got to work out how to actually do it.
My name is Lulu. I'm the Divisional Director of Digital Health at Western Health.
Excellent. It's great to see you. And so what brings you to the collaboration forum here with Oracle Health?
I think it's a really good opportunity to see what Oracle is doing in the roadmap and what they're actually putting in for Australia region. So that's the reason why I'm here. And it's also a good place to network with people.
Yeah. And tell me a little bit more about Western Health, because I know a fair bit, and I immediately think of geographical size when I think of your region. Tell me a little bit more about the region.
Yeah. So Western Health, we've got a number of acute hospitals, and we also got subacute sites. We recently take over Bacchus Marsh and Melton. So we're basically coming from most of the Western region. We're currently serving about 1.2 million people in the West, over 100 plus different languages in the West as well. It's a massive, list of, we've got mental health services, pediatric, maternity, ICU, theatres, ED, all that, outpatients. Yeah, and we've got 2 new hospitals, acute hospitals coming in. One of them is New Footscray, which is opening 2025, and the second one is New Melton, just close to my heart. That's where I live. That's 2029, and we've got a few community hospitals coming up as well. So we're gradually, expanding as we go.
Yeah, interesting. And so you've got that diversity and also the breadth in healthcare services required. I imagine digital plays an important role.
Absolutely. I think with the growth of the organisation and with the growth of population and the demand that we have in the West, technology is also growing as well with the needs. And I think there's a lot more digital maturity happening now than it was before, especially after COVID. when there's a big drive on adoption of technology and stuff. So we're definitely ahead, at least from Western Health perspective, executive perspective, we're definitely in the forefront of technology.
Yeah, excellent. I'd love to learn a little bit more about, say, some initiatives or that might be ongoing now or recently completed, or something that's happening within your region from the technology side that might be particularly interesting to kind of dive into.
Well, since we're at the Oracle Forum, I can talk about the Oracle EMR. So we started on that journey in 2016. I joined Western in 2018, and we went live with the first phase, which our CEO calls the baby stack. And in 2023, which is last year, July, we went live with the second stack, which is huge ones. All the specialist areas, all the clinical areas are now live on the EMR. And we basically got mobility out for our doctors early this year. And we're looking at doing some portals, and we're partnering with Oracle at the moment on their clinical digital assistant, and a number of other things like, patient portal, I mentioned before, and the patient administration system as well.
Yeah. I imagine then it's going to be important if you've got multiple providers in different locations delivering different types of services, pulling those together might be super important, because you want to ensure that continuity of care for patients to not have to continually to repeat the same things or have unnecessary tests. And is that starting to come together?
Absolutely. I think in 2018, when we went live with the first stage of our EMR, we had done Island Health team have done a research, and it's being published at the moment. And basically, they've significantly reduced their time takes to pull the medical records up, because in the past, they would have to travel to a different site to go and look for it. So they've gone from somewhere between 17 minutes and plus to about 2 or 3 minutes.
Yeah.
So there's a significant reduction. And, let's talk about legibility of handwriting, right? Nobody can read our handwritings and stuff. But now with the EMR, you can actually read it. Those are instant benefits you get from an EMR.
Mm-hmm.
Yeah.
And lastly then, what are some exciting initiatives you're working on at the moment or looking forward to making available to the population within your region from a technology point of view?
Oh, there's so many of them. I think the biggest thing is definitely, I mentioned before, the CDA, the Clinical Digital Assistant. I think just the fact that, I think you've heard Mike talk about it, we're trying to reduce it from 20 clicks to 1.
Yeah.
I think that's going to be a huge game changer. If we pull it off, it'll be a huge game changer. Based on what we've seen so far, it's developing quite rapidly. So I'm very hopeful that this might move EMR from a fancy Excel spreadsheet into actually something that will save people time.
Yeah.
Josh Simmons, I'm the Senior Clinical Director for Metro South in Queensland.
Excellent. Yep. And so we're here at the Oracle Health Collaboration Forum. Talk to me a little bit more about what brings you here.
I've been part of the Metro South journey for the EMR up there since 2015. So accidental career change. I'm a physio by background. It's a 3-month secondment that's lasted almost about 8 or 9 years now. So, coming down to see what the next things on the roadmap are from an Oracle perspective.
Excellent. So Metro South, tell me a little bit more about the digital needs within your particular region.
Yeah, so Metro South was one of the first digital HHSs up in Queensland. So we have 5 facilities up there, plus our sort of community services as well. A lot of them are on the EMR up there. And I suppose our challenges at the moment are about trying to get the digital platform beyond just the hospitals and how can everyone actually have access, because it's always been a bit of a black hole. You come into the facility, but then when you go out, how can we make sure that information translates back out to our primary care networks and other healthcare providers?
Yeah. Where are you finding that would benefit, which stakeholders that benefit the most? Because, I don't think anyone can argue with the fact that we need systems more interoperable and connected, because that just makes sense. But then is it more of a pain for the primary care network just because they need to collect a lot more information, or is it really a burden that the patient is facing? Where are you finding the biggest kind of issues in terms of not having the systems connected?
Oh, look, I think it goes across the spectrum, to be honest. Always break it down into 3 things. There's always the patient. There's a block for the patient there. They don't get all of their information to travel.
Yeah.
The clinicians, there's frustration in terms of giving and receiving information. And then the organisations as a whole are trying to get a better picture of where everyone's up to and where should they be directing their resources and the pathways to provide better care and provide better environments for our clinicians to work in. So, yeah. I'd say it goes across all. Like, I don't think you can break it down.
No. And, we're in this era of, exciting, innovative technology on the horizon, which is getting a lot of, any technology vendor around the world is reprioritizing how they're kind of utilizing AI and other tools to be more efficient or effective. In the end, there's healthcare to be delivered on a day-to-day that needs to happen now. How are you kind of finding, where do you see the role of more emerging technologies in, Metro South as an example, or in Queensland overall, that like how much of it is that would be nice at some point in the future, but hey, we've got stuff to do right now.
You always need the future to keep you enticed. That's true. And some of those things will definitely make a difference. But we've seen, even with an EMR, the lure of the data and how that can improve healthcare, it still lags behind a little bit. And I imagine some of these emerging technologies will take a bit to catch up. There's a lot we can do right now. Simple sorts of things around platforms so that patients can have more interaction with their own healthcare, better portals for our patients, better interoperability along lots of different things. So there's been enough here to say that they're trying to do the now as well as what's going to come down the track.
Yeah. On the point of patient portals, there's one school of thought that the only patients that are interested in accessing their health information are the ones that actually probably aren't the biggest priority for the healthcare system. How are you finding in reality the role of a patient portal, or I guess the interests or health literacy of the general population? Is it trending towards there is more of a need for patients to have information in their heads?
Yeah, well, at the moment we've got a program up in Queensland really looking at how we can operationalise that, and the voice from the community is very strong in terms of what they would like. It varies depending on who you talk to, but overarching, I just think people are becoming more up to speed with what they can control. And I think that healthcare is one of those things that we really need to give it as much power as we can.
Yeah.
I think there'll be education. We have to show them how to use it as well. But
yeah, was on the right path. And lastly, then, thinking about the future, what can we look forward to seeing from Metro South? Or where are your priorities and what are you focusing on, maybe from a technology point of view, to happen in the next 6, 12, 24 months?
Yeah, well, our strategy at the moment is really sort of around that digital front door concept and how we can really open it up. That transfer of information, getting the EMR out into the community. This week has shown also cybersecurity is also a big problem as well. So making sure that we're doing all of that in a trusted and secure environment. So hopefully we're rounding out as many as we can. But I think it comes back to that transfer of information that you sort of mentioned at the start. And how can we do that seamlessly and safely?
I'm Shelby Jasper. I'm from Eastern Health, and I work on the optimizations and enhancements team, and I'm an analyst on that team.
Excellent. Thank you. What about yourself?
And I'm Ricko, Suryadinata. I am also a clinical analyst on the optimization and enhancement team at Eastern Health.
Excellent. Well, so Eastern Health, obviously the theme for this conversation. Tell me a little bit more about what brings you both together and the work that has happened.
Yeah, so we came here today at the Oracle conference to present one of the biggest projects, or biggest project that we had over at Eastern, which is optimizing or essentially adding EMR functionality to our outpatient kind of space. Mm-hmm. And so we wanted to kind of present to and share our experiences and the different functionalities that we kind of implemented for our, fellow other health services, within Victoria and other states as well.
Yeah.
And hopefully, I guess collaborate from that, learn from our mistakes and learn on what's good that we did as well. And go from there.
Yeah. And so Shelby, from your side, so you're from the Eastern Health side, what were the problems to be solved? What are the needs within that particular region that this project tried to address?
Yeah, I think that one of the biggest issues was our clinicians were using multiple different systems. So they might have to use paper to order some items. They might have to view records on one system, but they couldn't place their orders there. They're having to go to many different places just to get one piece of information for a 20-minute appointment. So it was really detracting from that patient engagement. And so the EMR was really the focus to be able to bring all that documentation together. So nursing documentation, clinician documentation for the doctor's standpoint, billing, follow-ups for the clerical staff. And that way the clinicians could really spend more time with the patients.
And so I'd love to understand a little bit, you touched on the lessons to be learned. And I love these conversations about projects and the understanding, being able to share with others the process, because there's so much enhancement to happen across all different health systems across Australia. So in your presentation yesterday, talk to me about some of those lessons that you shared about the implementation.
Yeah, for sure. Probably one of the biggest one was training, training the medical staff, training different cohorts. As we kind of talked about in our presentation yesterday, everyone works different times, different days. We had some clinicians who worked maybe once a month. And so it was really hard to try to target kind of everyone at the same time. And I think, as you might know, and I guess as everyone else who have outpatient kind of clinics might know, clinics are very fast-paced. The clinicians, sometimes they have, their regular ward rounds during the day or so, or their private clinic somewhere else, and then they go to the public clinics, and sometimes it's just really hard to kind of get that as well. I mean, we did talk a lot about the different approaches we can do. For example, at Eastern, we did our virtual kind of training via Teams. We also did some kind of drop-in sessions as well. We offered those drop-in sessions as well as kind of just trying to target them at every angle that we can by different communication methods, emails, posters, whatever we can to try to get that, I guess, training up as well. And we also did like some online iLearn kind of modules as well. So the clinicians can kind of do their own self-learning from that as well. But even then, it's quite difficult. And I think from the feedback that we received after, what they would have preferred was like face-to-face kind of training, and that's how they would learn.
Yeah.
But, again, there was a lot of challenges trying to get everyone in the same room, and I guess just trying to get the time with everyone to try to get, the materials across as well.
Yeah, sometimes you got to work with what you got. Shelby, I'd love to learn from your side because, I know it can make so much sense from a top level about like this is a great workflow or a process, and that you hope that you get buy-in from all the clinicians to be able to utilize it. But I mean, I've heard it before. You don't understand me as this particular clinician. I'm different. I've got a particular workflow, or it's just that we don't fit this box. I'm sure at some point you've probably come across that kind of sentiment before. How do you deal with, something where you're trying to standardize a process or an implementation or something new that's going to add value overall, but then as you get into the weeds of it, there are these complexities, nuances, things that you don't know until you're really in there in the thick of it?
Yeah. So we really tried to keep the overall design pretty simplistic in terms of being able to place orders in the same spot. This is where you document your note. This is where you do billing. And that really allowed us to actually focus on those clinics with more complex workflows and those really different workflows. And that way we could spend time to really focus on those really niche problems that they were having and give them the time to be able to develop that solution. So by not overcomplicating the workflows of the more simplistic, I guess, clinics that have pretty general type of workflow each time for each patient, we were able to really focus on those more complex patient clinics where each patient might come in with a completely different problem and a completely different workflow to actually support their clinical appointment. So I really think that keeping the baseline as simple as you can to be able to train people and move between different areas of the hospital really gives you time to focus on those more complex workflows for those areas that really need it.
Yeah, absolutely. Lastly, thinking about then, and I might go to both of you for this one, but we have a lot of health systems, even from the vendor side, and others, stakeholders involved in implementing technology within healthcare settings. And I'm a firm believer, but that's, usually where things fall down because it's hard to go from an old system to an old process to a new process or systems. What advice would you give to those that might be in the midst of a process and it feels like it's in that valley of despair, or perhaps have tried an innovative idea and it's failed? It could be within a smaller clinic setting or within a big system. Like in that moment of this is not going to plan, like what's the process to get you out of that and then continue on the process? I'll go with you, Ricko.
Probably just try to keep it simple as well. I guess like what Shelby kind of touched on a bit earlier was that we try to make it as easy as possible to our clinicians as well. And one of the talks that we just listened to as well is that just because you can do something doesn't mean you have to do it. And so if it works in a way that the clinicians will actually, focus on the patient care and everything else, then you can start off from there and then kind of develop it from there as well. And I think another thing would be the importance of just that buy-in, that initial buy-in from the clinicians, and kind of having those like SMEs, like and kind of someone representing each cohort, medical, nursing, allied health, just to kind of be that voice for them as well, and just continue to work collaboratively. So, yeah.
Good advice. Yeah. What about you, Shelby?
Yeah, on Ricko's second point, I think I really noticed that in the areas of the clinics that we could actually get a SME or a subject matter expert that we could work closely with, and they could really help provide input of what would work, and they helped test it as well, and they helped talk to their teams about it, and they got the word out there. That really helped kind of put a Band-Aid over you're going to take away my paper, you're going to take away this system, I don't want to do this, because it was coming from their colleague, it was coming from someone that they actually knew, whereas they might not know the project team because they don't work with them all the time. So we really found that the clinics that we were able to really work heavily with some of the people that actually worked in those clinics while the project was ongoing. At Go Live, we noticed that they had a lot less teething issues because they were kind of prepared for it. She already knew the gotchas, that there was, I can call this out. This is going to be an issue for this team. Let's focus on this. So I do think that, like Ricko said, that early engagement is so important. It might not always get rid of all the despair for all the users, but it does certainly help mitigate some of those risks as you do go live.
And last one, I promise that but I'm just thinking now, so the project at the stage it's at, and you've got through this stage. There's always a what next. So now that we're at this stage with Eastern, what are you looking forward to then reaping benefits from the implementation?
Well, I guess from this project in particular, we're really looking at actually expanding the use of the EMR to other areas of the hospital, or I suppose in the areas of the clinics and other areas of the hospital. Yeah. As we move people more and more into the EMR, the teams that aren't on EMR are now asking to be on EMR. And so it's so much easier to have a project whenever your clinicians are asking to be put on EMR instead of being forced to put on EMR. So I suppose maybe not so much in the outpatient space, so that project, but really the benefit to the other clinicians that are wanting to get on EMR. It's really exciting to work with them now because they're excited to use EMR. They're engaged. They kind of have learned what's worked from their other colleagues, and they're ready to do it. So it's great.
Amazing.
Yeah, I think just to kind of echo Shelby's point there, it is we do now. Looking back where we first started back in February with this project and had our go live in November, and now it's almost a year. There is a lot more, positive engagement from the end users, the clinicians as well. Just because I think, as with any initial rollout, there's always a lot of pushback and just not having that full understanding of the system. But now because they've gotten used to the system and really liking it, enjoying it, then they're starting to think what is next for them as well. And so that's obviously exciting for us because we're like, oh, great, we have that kind of buy-in as well now. Okay. And so we can definitely work with you, and it's a lot easier to work with everyone, and it's going to be great for, across board and expanding across, the greater Eastern Health Network as well with our EMR implication.
We hope you enjoyed this episode of Talking HealthTech. Make sure you like and subscribe and share this episode with someone who might find it valuable. For more information and resources about healthcare innovation, visit talkinghealthtech.com.